Not really. See, we have been looking at the Gulf countries, which has received large doses of Sinopharm, and they seem to be taking it very comfortably, and we're all looking at them. So I think, no, we're not terribly concerned about Sinopharm. We are hoping to get the AstraZeneca Oxford soon. We're hoping to get the Russian Sputnik V within the next couple of weeks. But what we are really looking forward to is getting the other Chinese vaccine, CanSino, for which we have done the double-blind, placebo-controlled trial throughout Pakistan. We've enrolled about 18,000 participants, and the results are expected very soon. So we're hoping that if that gives us good results, then we will also look forward to getting the single-dose CanSino vaccine.
But the hurdle is getting the population to be vaccinated. A lot of them are hesitant. Why is that?
I think a large percentage of our population is still in denial about the disease itself. You know, our numbers are not as large, largely infected, or death rates are not as large as, say, in the neighboring countries or in Europe or the Americas. So people are a little bit reassured that they're not going to get the disease anyway. And then, yes, there is definitely a hesitancy. But I think that will get better with time when people are, they're kind of waiting and watching and to see whether their neighbors are going to get it. And so I think they will come round. Definitely not, I don't expect that this will go up to 70% as we hope for herd immunity. But nevertheless, I think it will pick up with time. The first batch of vaccine arrived only 4 or 5 days back, and this was the long weekend. And so I think the uptake has not been very promising so far, but we are hoping that with more publicity, with more awareness, people will take to it. We're hoping for the best so far.
Well, what proportion of the population is the government aiming to inoculate, and by when?
Pakistan has the population of Pakistan is over 200 million. And we have a very large percentage of young people, the youth. And if we exclude them under 18, then we hope our requirement would be about 125 million doses to vaccinate about 57% of the population, which, if accomplished, would give us 70% herd immunity.
And just finally, how are hospitals in Pakistan coping with the pandemic so far?
When the outbreak first started back in a year ago, of course, we were very alarmed. The government came out gave us a lot of information, advisories, and so on. And then the first wave peaked and came down. And then again, the second wave came in September, up to, say, about end of November, December. And now it is on the downslope again, to the extent that we are seeing less than 2,000 diagnosed cases a day, and about 30 to 40, max 50 deaths a day. Of course, we may not be doing a whole lot of testing, but nevertheless, we're not really seeing it getting too bad. There are a lot of severe cases who are being managed at the hospitals. But even today, when I went down to the emergency room to see what the conditions were in my hospital, I was pretty reassured that the numbers were not that high. And the positivity rate has come down now to less than 3%. It hovers around 2 to 3%. So we're a little reassured in that, even without the vaccination. But we don't know why our numbers, well, we're thankful that they're not as dire as those in our neighboring countries in Europe and in the Americas. But we're definitely not seeing such large numbers. And that is why the population, the public is more complacent about the infection and not falling over each other to get the vaccination. But I think in due course of time, this will pick up. I'm certain of that, at least amongst the vulnerable population.
Let's hope that downward trend in numbers continues. Dr. Naseem Salahuddin, thank you so much.
Thank you.